Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about H2 blockers. So H2 antagonist group of drugs this includes cimetidine, ranitidine, famotidine, roxatidine, nizatidine, and this includes loxatidine. These drugs will block the H2 receptors, and by blocking the H2, these are H2 blockers, and they will decrease the acid secretion, basal acid secretion. Cimetidine is actually least potent H2 blocker, whereas famotidine is the most potent H2 blockers, and famotidine is competitive, is either competitive or non-competitive H2 blocker, whereas loxatidine is a non-competitive H2 blocker, whereas the rest roxatidine, nizatidine, ranitidine, cimetidine, all these are competitive H2 blocker. So if you see nizatidine, one more important thing is nizatidine is anticholinesterase. It has anticholinesterase activity, and because it has anticholinesterase activity, because of that it can cause bradycardia, and it causes increased gastric emptying occurs because of this anticholinesterase activity. Then nizatidine has negligible first pass metabolism. It has negligible first pass metabolism is nizatidine. Right. And one more important one-liner. All H2 blockers except famotidine will inhibit gastric first pass metabolism of ethanol. So all except this will inhibit gastric first pass metabolism of ethanol. Okay, so this is about the H2 blockers. Thank you for watching.
Thank you and thank you for watching.